Hello to our Gold participants from around the world. I'm Fiona Lang-Sharp, IBCLC Public Relations Manager and MC for Gold Learning. Well, I'm chatting with Bobby Bellflower today, who is going to be speaking at our upcoming Gold Neonatal Online Conference 2017. And she is going to be presenting on necrotizing enterocolitis. Welcome, Bobby. It's great to have you here today.
Thank you. I'm
So,
happy to be here.
Well, we're very excited to have you, and I know that this is a jam-packed PowerPoint. I know you have a lot to say on this, Bobby. Very passionate in this area. But why don't you start off, maybe introducing yourself briefly to our listening audience today? Tell them a little bit about what your life looks like today on a day-to-day basis, and then we'll get into the topic just in a moment.
All right. My name is Bobby Bellflower. I'm a neonatal nurse practitioner. I have been a neonatal nurse practitioner for almost 30 years now. I practice at the Regional 1 Neonatal Intensive Care Unit in Memphis, Tennessee. It's a Level 3C NICU. We also have a children's hospital where we do a lot of our surgical interventions at Le Bonheur Children's Hospital. And I'm also the director for the Doctor of Nursing Practice program at the University of Tennessee Health Science Center in Memphis, Tennessee.
And so on a day-to-day basis, Bobby, it sounds like you're pretty busy.
Yes, I am. On a Monday through Wednesday, I'm usually at the university teaching students, taking care of administrative issues with the doctoral programs, doing some research, some quality improvement processes. And then Thursday and Friday, and sometimes over the weekend, I do the clinical aspects of my job. So I see patients usually on Thursdays and Fridays.
Oh, wow. So you're in all areas, which is wonderful. With all that
Yes.
knowledge that you have, it's great that you're able to mentor this down through to students, which is fantastic. Which leads me to
Mhm.
this particular topic that you are going to be speaking on. Can you perhaps share with us why this topic is so important to you?
As a neonatal nurse practitioner, especially for such a long time, I have seen babies doing very well, born very extremely early, extremely premature. We get them through the initial acute phase, start feeding them, and then they develop necrotizing enterocolitis. And a significant number of these babies die. And the ones that do not die, many of them, up to a third, will have some significant long-term sequelae that they will have to deal with for the rest of their life. So it is important for us to understand necrotizing enterocolitis, how to treat it when it does occur, but more importantly, how to prevent it. And there's some exciting research on the horizon that in the next few years, we the incidence of necrotizing enterocolitis may diminish greatly. I'm not sure we will ever get to the point where there's not any necrotizing enterocolitis or NEC, but I do think that there is very exciting concepts in the next few years, maybe in the next few months, and we may be able to prevent and treat necrotizing enterocolitis.
Well, that sounds very exciting. I hope that during our presentation you'll have an opportunity to tell us a little bit more about that research, and we'll certainly be looking for it. So, lastly, before we wrap things up today, Bobby, perhaps you will share with us what you're most looking forward to sharing with the delegates and what you hope that they will take away from this presentation.
A couple of the things that I'm really looking forward to sharing is to hope to make sure that everyone understands what we think is the pathophysiology of NEC. It's multifactorial, so there's not just one pathophysiology. But you really need to understand the pathophysiology before we can adequately treat it and we can prevent it. one of the main things that I want people to take away from this discussion is how important human milk is to newborns, especially premature newborns. And so we're going to talk a lot about providing a complete human milk diet for many of our preterm babies in the hopes of preventing necrotizing enterocolitis. And then the next thing I hope we'll take away from this is that there are many things that we can do to diminish the chances of a baby getting NEC. And hopefully, in the near future, there will be very little NEC, if any at all, if a lot of the current research pans out.
Well, I'm so intrigued, Bobby, and I'm very excited to be able to be part of this presentation. It sounds like you have a lot to share, and I know you're very passionate about it. And I know earlier when we were talking offline, one of the things that you pride yourself in is keeping this up to date and keeping that information at the forefront for all of us that are learning about necrotizing enterocolitis. So thank you so much for sitting down and chatting with us today. It was just lovely to chat with you.
Thank you.
And we'll look forward to having you at our Gold Neonatal online conference. I can't wait to hear more about this and so many other topics. Thank you again for joining us, and thank you to our listening audience. Bye bye for now, everyone.